Good morning, everybody. Today we have with us Dr. Selvam Karthikeyan, who is a doctor from Malaysia, who is a very senior psychiatrist who's been in this field for a very long time. He is now almost semi-retired and doing advisory roles to various people. So, good day, Dr. Selvam.
Good day, sir.
How are you doing today?
I'm very good and I'm very excited about this sharing of information. Uh, as I say, life is a journey. And when we have traveled so far, I think it's a pleasure to share the journey so that our colleagues, our juniors, our seniors, and anybody who is interested in health can benefit from it.
Yeah, we are very happy to have you here at the Prism Academy's first international integrative medical conference in Chennai. We've heard a lot about integrative medical space from a lot of speakers. Now, I would like to know from my understanding, since when you started practice and how did you sort of come into this space and what has been your journey? Can you please elaborate a bit on that?
It is going to be a long story, sir.
Yes, we have all the time.
And I started my career, strangely enough, in Chennai. I graduated from Stanley Medical College. So this is why my heart is still here.
Right.
The best years of my life, my basic grounding, I will say, is thanks to India, particularly Chennai, and all my colleagues, friends, teachers come from Chennai. My journey started like everybody else's as a person who looks at conventional medicine. Now, conventional medicine is what we all practice, and many people continue to practice conventional medicine. I have to say, my life journey was a bit different. After completion, I went back to Malaysia, where conventional medicine is still the main format. But I had the opportunity to specialize quite early in my life. And having been trained in all the other disciplines, I decided to do psychiatry. In our days of psychiatry, one of the rules of psychiatric selection is you just cannot opt for psychiatry once you have graduated. You have to have done general medicine, surgery, and obs and gynae or something like that
Right.
for quite some time before they think they want to take you into psychiatry.
Right.
Whereas nowadays, post graduation, after once you
Straight,
decide, you go straight.
straight into the
But they didn't want that at that time because they felt that psychiatry is the end stage of medicine.
Okay.
And you must be able to make sure that that person doesn't suffer from serious other ailments
Mhm.
and not make a misdiagnosis in psychiatry. Because if you make a diagnosis in psychiatry, that sticks to your life
Mhm.
forever. So that was the trauma, phobia. So they were very careful.
So they wanted the person to be adept at all handling all the medical side of things before actually allowing them into psychiatry.
Absolutely.
Mm.
So the person must have had fair sense of
Mhm.
exposure to almost every field.
Exactly.
It'll be surprising nowadays. People ask me, Doctor, you are a psychiatrist, but how do you know so much about orthopedics? Because I did orthopedics.
Exactly.
I have assisted in hip replacement.
Right. Even in theaters.
Yeah.
Yeah, exactly.
So this is not about talking about one's exceptional skills or anything, but I'm saying you must have that broad exposure.
That's right.
Now, taking that back into integrative medicine, I would say that integrative medicine or integrative health is not for everybody. So, in a similar concept, one should be fairly exposed to conventional medicine, complementary medicine, traditional medicine, and one should be an open mind. Because end of the day, what we want is good health. It's not about a medicine, a technique, or any other form, but it should be what gives relief to the patient. So, the conventional medicine, if you look deeply, it is about the disease.
The focus is on the disease.
So, the first thing they will say is, what's the diagnosis? Of course, even in integrative medicine, we can start there. But where we are different is, you go back and look at why the disease.
Exactly.
And it slowly shifts to focusing on the patient. Why does this patient suffer from this? Which is very similar in a lot of ways to psychiatry. I mean, I can go through stress, you can go through stress, we don't get depressed.
Mhm.
But a good friend, a good colleague of ours, who goes through the same stress will get depressed.
Mm-hmm.
So we have something that we call individual approach and perception.
Mm-hmm.
And I think diseases are also similar to that. So when we start looking at why now, and what happened to create this situation, I think that is the beginning of integrative medicine.
Okay. And what prompted you to sort of, get deeper into it? And how deep have you got into it at the moment?
Well, like we shared earlier, it's a life journey.
Hmm.
I went back to Malaysia. I did my compulsory service there, and by strange luck, I got selected to go to UK to do psychiatry, which was, I think, a gift. But when I went there, I was mostly interested in research. We were looking at depression and schizophrenia, and I had a lot of interest in schizophrenia, and I did a lot of clinical trials, research, and so forth. And as part of these trials, we were working on a molecule which was specially meant for treatment resistant. Now, the selection to put a patient on this drug is they must have had at least two other drugs for treatment, not responded. Then only they qualify to use this particular drug
To enter into the trial.
to enter into the trial. That's why the drug itself was known as for treatment resistant schizophrenia.
Hmm.
So during this recruitment of patients for this trial, we see patients who have had two or three different types of medicine and they have not responded. And one of the main things that come up with schizophrenia is hearing voices.
Mm-hmm.
So they will hear as though somebody is talking to them all the time. And sometimes you see them even actually engaging in the conversation, like they're talking to somebody really there. So this is one of the, what I would say, hallmarks of schizophrenia. So when we are doing this trial, like in all trials, there will be a certain number of what we call dropouts. For various reasons, that patient may not be able to continue on the trial. So it put me in a very difficult situation. In the sense, we are recruiting patients saying this is the ultimate, the mother of all treatment for schizophrenia. Then, for some unfortunate reason, the patient cannot continue on the trial. And that's a serious scenario for me because one of the high risk of schizophrenia is suicides.
That's right.
And you're bringing somebody telling them this is the best and final drug, and then you have to tell them, no, you cannot take this medicine anymore, you're out of the trial. And my heart was saying, this person has got every chance to go and kill themselves. So I then spoke to my supervising professor. I said, this is a scenario. What shall we do about it? Because there was another trial at that time, and some suspicions from another research that I was doing that there was a missing amino acid. So why don't we just try giving this particular nutritional supplement and see how it happens? Well, believe it or not, the large number of patients who are not even responding to the ultimate drug, the voices stopped.
Fantastic. So it was some kind of deficiency all along.
That was an eye opener. That there could be something more. So, in a way, I'll say that was my turning point in life. Working with pharma industries, working with new chemicals, we have gone as far as splitting molecules.
Mm-hmm.
That's the pharma industry because a molecule A, which is about to expire, they will have to look at how do we survive in the market. So we split the molecule. That means every molecule will have two strands,
Mm-hmm.
active strand and inactive strand. So we remove the inactive strand, which sometimes carry the side effects. So it is a cleaner drug.
Mm-hmm.
The results were not that different from the older drug.
Okay.
So it made me think and say, is there something else that's going on? And the more and more work we looked at, nutrition became a key element. So as you know, I would say in a way it was a distraction, but it's also opening of my knowledge in thinking there is more to a disease formation than just a disease itself.
Yes. The focus on nutrition is changing a lot. Of course, you identified this way long back, but just of late as we speak, the medical nutrition side of things in chronic diseases like diabetes also is gaining traction. People are actually trying to focus on nutrition to reverse their diabetes as opposed to taking medicines. And this awareness and these things have much more to do post the pandemic, where the awareness of good health in general population has flourished a lot, I would imagine. So, where did this nutritional journey, once you identified that, where did it take you from there?
Okay, coincidentally, at that time, I got exposure to Parkinson's
Mm-hmm.
in the sense that in the UK, people with Parkinson's also do have emotional instability. Some of them get depressed, some of them can hallucinate, and they eventually will end up seeing us. So I got roped in by the Parkinson's group
Mm-hmm.
to look into how we can assist them. But what was our tagline at that time is we create our illness from the food that we ate.
Mm-hmm.
And I remember typically that we were very anti microwave.
Mm-hmm.
I don't mind sharing the story with you.
Mm-hmm.
I'm sure we have all had microwave.
Yes.
And it tastes different when you microwave a food than when you cook it on a pan or a
Oh, definitely,
vessel.
definitely. Especially in the UK, when I lived in the UK, we had the same.
Yeah, we can almost make anything.
Yes.
From omelette to baked potatoes, we can make it in the microwave.
Mm.
But it tastes different when you cook it using the oven or some other form of cooking. That's because it was then explained that the cooking was done by internal energy. That means the molecules start vibrating, which creates the heat. So the food cooks from inside to out.
Mm-hmm.
That's all fine. It cooks evenly from inside to out. So that's why you don't have to cook for too long. And the heat remains in the food, which is fantastic for cold countries because the food remains warmer for a longer period of time.
That's right.
But the funny part is, they say when the vibration happens and it cools down, the molecules do not settle in the same place.
Right.
So now you're getting a mutated food.
Right.
Which then explains the difference in the taste.
Ah. Very interesting.
That is why, I learned it out of experience.
Mm.
I don't think I read it from a book, but this is how it was explained. So most people who have the diagnosis of Parkinson's, the organization will discourage them from warming up their food or cooking using the microwave.
Right.
And that was one of the things that we tell our patients or clients. Try to avoid using as much as possible microwave. Now that was an eye-opener. So you can see that my life experiences were meant to take me in a different direction from there. And so I started exploring, other things. And funny enough, one of the things about Parkinson is they lose their sense of smell very early.
Right.
But they don't realize. We don't go around sniffing most of the time unless we get a smell that is terribly nice or terribly odd. We don't even pay attention to smell.
That's right.
So we don't focus on some of these senses, taste, smell. We would say, why is there not enough salt? We don't realize that our taste buds are becoming nullified. Same with olfactory, our smell. These are some of the earlier signs of Parkinson's, actually. Similarly, constipation.
Right, yes.
They say Parkinson takes about 20 years to actually develop.
Oh, right, okay.
But it starts at not so sensitive smell, not so sensitive taste, which we all ignore.
Yes.
Say not enough salt. And somebody else sitting next to you, if the wife is sitting next to you, you say, I put enough salt.
Enough salt, and they feel it's adequate or even more sometimes.
And then we'll have an argument, and we forget the whole thing because of the argument. And she'll say, the wife will say, oh, and nowadays you don't like my cooking. So you see, the focus is shifted.
Yes.
It's not, why don't I taste it the same way? Because it's the same wife cooking the same food.
Exactly.
And she's been cooking for years out of experience. She can close her eyes and cook. But we don't look at it that way. We say, you are changing. But we don't go further than that. So some of these symptoms start as early as 20 years and we ignore it. We only notice it when we start having the tremors.
Exactly. Which is far too gone in the disease process.
But it's still not too late. We start saying, oh, maybe my sugar level is low. That's why I'm having tremors, which is true. Because we don't want to think about the less possibilities or the less serious scenarios. We like to take it light. So when we notice the first tremors, we say, oh, I'm tired. Maybe I'm not enough sugar. If I take coffee or tea, this tremor will go away. But that kind of support comes in. So we are ignoring it. We pay less attention. Then our movements become slow. Even then we try and ignore. Oh, I must be tired.
Yes, right.
Because I didn't sleep well. Well, that's another symptom. People who develop Parkinson's do not sleep well.
Okay.
Because their melatonin becomes denatured. They don't have enough melatonin. They don't have normal sleep pattern. They're not sleeping well. When they wake up, they are feeling tired. They have tremors. We build a different story.
Exactly.
To explain everything. But this is what is Parkinson all about.
Right.
We had a tagline that food is your best medicine at that time, which is very true. So some of these early symptoms actually can be treated by focusing on what is creating this problem. Basically, we know in Parkinson's is the dopamine factor, which can be because of less dopamine production or early neuronal death. That means the nerves are beginning to die.
Yes.
Now, actually, people think that it's a straightforward case. Okay, nerves are beginning to die. There's nothing much we can do about it. If it is just dopamine, we give dopamine supplementation. But we don't question why the nerves are beginning to die.
Exactly.
So there comes the nutrition part. There must be something that is triggering off. Is it in our genes? Is it in our lifestyle? Is it in our environment?
So these are the most common things, the three things.
These are the threshold, three major things that focuses on any disease, just not Parkinson's, almost every disease. Your genetic lay, your lifestyle, and your environmental factors. These three can make big differences to any disease. So when you talk about genetics, we have no choice about changing our genes. In fact, if you look at our genetic layout, most of us carry the genes for almost everything. Some are dominant, some are recessive. Dominant means we have a higher chance of developing that illness. Recessive means we have lesser chance of developing.
That's right. Yes.
Now, what determines whether we develop it or not? Okay, that comes from your environmental factors. Let's say we already carry the gene and we live next to a plantation that uses toxins like paraquat or pesticides. As we walk by that place every day, we are inhaling that.
So susceptible gene is triggered due to epigenetic factors.
Absolutely, sir. It's called the waking of the gene. A gene that is sleeping, you're literally knocking on the door and say, hey, I'm a visitor.
Yes.
Okay, still not so bad. What happens? Our lifestyle. We stay up. Most people go to sleep these days around 2 o'clock in the morning. When I tell people I go to bed by 9:30,
they look at you as if I'm a different generation.
They look at me very oddly.
Okay.
So early. He said, for us, we come home at 9:30. By the time we finish dinner, it's 10:30. By the time we talk to my kids and wife, it's midnight. By the time I ask my family what bills to pay, well past struggle to go to bed at 1. Sometimes it's 2. Or then the younger generation that goes to bed at 3 o'clock in the morning.
Yes.
So sleep is an important process in life. We have shifted the goalposts.
Yes.
So now we have somebody knocking on the door and we provide the environment, the stress factors, not enough sleep, not enough melatonin. Then you're literally saying, not only just knocking on the door, you're opening the door and say, hey, come on, get up from there.
It's causing a lot of disruption in their this thing,
Yeah, and this is the model
Mm.
that fits almost every other illness, just not Parkinson's. If you talk about cancer, it's the same scenario.
Yeah.
All of us carry
Mm-hmm.
cancer genes.
Mm-hmm.
And what determines is our natural immune system
Yeah.
to create what we call natural killer cells
Mm-hmm.
that keep these cancer cells under control.
That's right.
But then what happens? Again, the same environment, the stress, we ignoring basic things
Mm-hmm.
lets the natural killer cells to reduce.
Mm-hmm.
Same like the dopamine reduction in the
Yes.
brain,
Mm-hmm.
natural killer cells become less and less
Mm-hmm.
as we age.
Yes.
So now the cancer cells become more powerful.
Mm.
And that starts the process of the disease. So in integrative medicine, the takeaway knowledge is
Mm-hmm.
pay attention to all the factors. And there is no single factor
Mm-hmm.
that produces an illness, which is why I say two people put in the same environment may not develop the same disease.
Exactly. That's true.
So that's the core, the heart of integrative medicine is
Mm.
be patient focused.
Okay. Good. Is there any particular area of interest you are working on currently with regard to the patients? For example, anything to do with Parkinson's and the brain, or anything like that? Any particular area of interest which you would like to share a few things about?
Yeah, I mean, I basically my core focus is integrative.
Mm-hmm.
I'm looking at some of the more uh, what I would say is damaging illnesses we have.
Mm-hmm.
When I say damaging, you see, every illness
Mm-hmm.
causes huge damage
Mm-hmm.
in socioeconomics, in policies of the government.
Mm-hmm.
It's not just seen as a disease.
Mm-hmm.
For example, diabetes.
Mm-hmm.
Somebody gets diabetes. A is the cost of treating the illness,
Mm-hmm.
which is sometimes supported by the government, or the patient themselves have to fork out the money. That causes an economic weight. The disease itself doesn't stop there. Your job is affected,
Mm-hmm.
your productivity is affected. So, if you see from that point,
Mm-hmm.
a disease can be a huge factor
Mm-hmm.
into national economics
That's right.
contribution. It's how much the state has to bear your treatment. It's how much you can contribute back to the society. So it's a multidimensional thing, which very often as a patient, most people do not think about.
That's right.
I have diabetes, so I treat myself. It doesn't stop there.
Exactly.
When you have diabetes, you get more tired.
Mm-hmm.
So your efficiency at work will be lowered.
Yeah.
You get scolded by the bosses every other day.
Yes, that's right.
And you're saying, I'm doing my best. Certainly you're doing your best. But the boss doesn't see it that way.
Mm.
He doesn't think you are diabetic. Your thought processes may be a bit slow.
Mm.
You tend to get tired more. He doesn't think that way. He says most people can finish the job in 2 days. What's wrong with you?
Exactly.
You're taking 4 days. So you see the productivity chain. Everything is connected somehow.
Yeah.
So the whole aim in integrative medicine is try to bring this illness back into control,
Mm-hmm.
if possible, reverse it. Now, in today's world of medicine, most of it, every illness or every complaint, there is a medicine for it. But it doesn't cure you.
Yes, that's right.
It just controls your symptoms. And you go on from one medication to another to another.
And from one doctor to another.
Absolutely. If this doctor doesn't do well enough, you're going to change the brand,
Yes.
So I think it's time for the medical fraternity in general to wake up and think, what are we really doing? Where are we heading? I mean, my generation of my doctors, my teachers, my professors, I would say at that time our concept was, how do we bring comfort to the patient? And today in a developing world, it's completely different. We have huge corporations, you have huge management costs.
That's right.
So the approach is fairly different. But I think as doctors, we shouldn't stray too far. I mean, it is a fact. If you build a hospital, you got to run it. You need economics. And economics factor is a very important ingredient for maintaining the quality of care. But at the same time, what is the client getting or your patient getting?
Right.
And are we just treating symptoms? Or are we going back to reversing some of these illnesses or minimizing the damage?
Mm-hmm.
Because let's say somebody developed Parkinson's,
Mm-hmm.
we detect at an early stage. we put them into a situation where they change their lifestyle,
Mm-hmm.
have good nutrition, their symptoms don't become worse.
They have a quality of life for a longer
The
period.
quality of life improves a lot, and they need less dependency on others, which means somebody can leave them at home and go to work.
That's true.
Where in some cases, the wife will have to resign to look after the husband or vice versa because the person can't look after themselves. So if we catch it early enough, we can alter their lifestyles, alter their food pattern, or reduce the risk factors. Then we are bringing quality of life into action. Simple things like, coming from a poor background, we are all used to mosquito coils
Mm-hmm.
because we're thinking about keeping the mosquitoes away because we think if mosquitoes bite us, we're going to get dengue in today's climate.
Mm.
But have you realized that it contains a chemical called pyrithium,
Thank God.
which is neurotoxic?
Mm-hmm. And we have been inhaling it keeping it next
No,
to the
when
veg.
one coil is not enough, we like two, even three. I've been in that scenario. That's why I'm saying this.
Yeah.
Say too many mosquitoes, so let's light one more.
Mm-hmm.
And we can literally smell this.
Yes. I agree.
And we're happy that we're not going to get dengue.
Mm.
But 15 years down the line, we're going to get Parkinson's.
And
So these are some of the things that we don't think about. And now we see a lot of cooking is done in aluminium vessels.
yeah, toxins are present very much in the environment, and we don't understand the impact it has. The amount of toxins in various environments, the endocrine disrupting chemicals which is present in the preserved foods, all these things take a great deal of beating on your health.
You're absolutely right, sir. See, I remember one of my teachers, Dr. Schallenberger,
Mm-hmm.
who is a master of Ibu.
Mm-hmm.
I think we did the same conference together. Yeah.
Yes, 6 months back.
Now, I remember his tagline
Mm.
there is no poison,
It's all in the dose.
it's all in the dose. So, those days, most people ate at home.
Mm-hmm.
And we had iron pots. If you remember, our towers were all made from steel cast iron.
That's right.
But nowadays, eating at home is the other way around.
Mm-hmm.
Rarely we eat at home.
True.
So, in a restaurant, to cook fast, to get that amount of heat, to cook a rapid meal, and to get into that tasty thing, they use aluminium vessels.
Right.
So, our food is loaded with aluminium.
Mm-hmm.
Now, aluminium is not a toxin per se,
Mm-hmm.
but when we eat outside 7 days a week,
Mm-hmm.
the cumulative toxin then starts its role. Like I say, the amount becomes more. So when we do the analysis, we find all these metals in our system: mercury, manganese, aluminium, copper. Copper, we used to drink from copper vessels.
Vessels, exactly.
But how do we take that copper? Most Hindus will know they'll put the copper vessel on their altar
Mm-hmm.
and they put tulsi leaves.
Tulsi leaves, exactly.
And at the most, they will take the tulsi leaves to eat, or they will take the sprinkling of that water
Mhm.
along with the tulsi leaf, and that's the amount of copper that our system needs.
Mm-hmm.
But that was mistranslated
Mm-hmm.
into thinking you need copper,
Mm-hmm.
and people started drinking from copper vessels.
Mm-hmm.
Copper is a toxic metal;
Mm-hmm.
it enters the system, and that's another ingredient for Parkinson's.
Mm-hmm.
So when we do the analysis, you see copper levels sky high, aluminium levels sky high. Then you have mercury,
Mm-hmm.
which is in everyday food.
Yes.
Now, in homeopathic medicine, mercury is used as a medicine.
Mm-hmm.
But again, going back to Dr. Schallenberger's,
Mm-hmm.
it's the amount that makes it toxic.
That's right.
So this is where, we have essential minerals, trace minerals, which are all fine as long as they are within that dose. In fact, they help functionality. Our basic cellular function
Mm-hmm.
is based on that.
Mm-hmm.
But with our modern style of living,
Mm-hmm.
the doses are going up of this, which should be only just a touch,
Yes.
is obviously noticeable.
And what you're saying is all these things, they go and knock on the sleeping gene and wakes it up. And
Exactly. Because they're all friends of the enemy. So when all of them join,
Mm.
you develop an illness.
Yes. And be it any chronic illness for that matter, including cancers and neurodegenerative diseases, autoimmune diseases.
Absolutely. I mean, most diseases start from the gut.
Mm.
There are two great guys in our gut. One is the liver, the other is the intestines.
Mm-hmm.
That is the root of all evils.
Mm-hmm.
Now, we used to eat chapatis those days, rice those days, which were all not malformed checks. Today, we have milled meat, the modern genetically modified meat, which contains certain byproducts which become toxic.
Right.
And what does that toxin do? It makes the intestinal lining weak. And the poison then leaks into the bloodstream, which goes to the brain. That's what we call it leaky gut.
Yes.
That's the beginning of the problem.
Absolutely.
But at the same time, the metabolic reactions, the sugar gets kicked into the liver. Liver becomes unhappy. Liver starts kicking the intestine.
Yes.
More toxins are produced. Again, the leaky gut syndrome.
Yes. So it's a cycle. It's interrelated cycle, and it just makes it worse for the Parkinson's patient.
So now we have fatty liver, cirrhotic liver. We have a leaky gut. All the toxins enter the system.
Leaky gut also leads to leaky brain, which
absolutely. So that's the liver gut brain axis, which then becomes the mother of all evils.
Okay.
So I think the takeaway message from here is look at a client or patient, look at it in a holistic way. Do not just target the disease or the symptoms. You have to become a detective.
Absolutely.
To a large extent to find out what is causing this issue and then treat those issues. And I think you will come out successful in any disease management better than what we are doing now.
Fantastic. Thank you so much, Dr. Selvam, for such an insightful session today. I hope we can continue to benefit from your experience in the future.
Pleasure is totally mine, sir. And thank you for giving me this opportunity to share with you my thoughts on this. I know that there's a lot of things that I've said can be a debatable topic. I'm happy to engage in discussions. I don't like to debate, but I like to discuss because I too, it's a continuous learning process. We all learn.
For everybody, yes.
Thank you very much for having me.